Ministry of Health of Ukraine. Krok 2. Medicine. Year 2020, number 013. A woman with the pregnancy term of 8 weeks complains of elevated temperature up to 37.6 degrees C, skin rash that can be characterized as macular exanthema, enlargement of posterior cervical and occipital lymph nodes, small amount of bloody discharge from the genital tracts. She was examined by the infectious diseases specialist and diagnosed with rubella. What tactics should the obstetrician-gynecologist choose? A. Prescription of antiviral therapy. B. Treatment of incipient abortion. C. Prescription of antibacterial therapy. D. Abortion. E. Prescription of hemostatic therapy. Rubella is transmitted primarily through direct or droplet contact from nasopharyngeal secretions. Humans are the only natural hosts. In temperate climates, infections usually occur during late winter and early spring. The average incubation period is 17 days, with a range of 12 to 23 days. Infected people are most contagious when the rash is erupting, but also contagious during 7 days before and after the rash appears. Symptoms of rubella in adults: low-grade fever, headache, conjunctivitis, rash that starts on the face and spreads to the rest of the body, general discomfort before the rash appears, lymphadenopathy, sore throat, cough, runny nose. However, 25 to 50% of people will not experience any symptoms. Exanthema is a widespread rash usually accompanied by systemic symptoms such as fever, malaise, and headache. It usually occurs in children. It is usually caused by an infectious condition such as a virus, and represents either a reaction to a toxin, drugs, or microorganisms, damage to the skin, or an autoimmune disease. Congenital rubella syndrome is a condition that occurs in a baby of a mother who is infected with the rubella virus. The pregnant woman is at risk for miscarriage or stillbirth, and her baby is at risk for severe birth defects with devastating, lifelong consequences. Birth defects from congenital rubella syndrome. Most common: deafness, cataracts, heart defects. Intellectual disabilities, liver and spleen damage, low birth weight, skin rash at birth. Less common: glaucoma, brain damage, thyroid and other hormone problems, inflammation of the lungs. Examples of viruses causing a viral exanthem: enteroviruses, adenovirus, chickenpox, varicella. Fifth disease: measles, rubeola, roseola, HHV6A, HHV6B, or HHV7, rubella, German measles. Mononucleosis. Causes of cervical lymphadenopathy: common cold, bronchitis, ear infections, scalp infections, strep throat, tonsillitis, nose, throat, or mouth infections, dental infections. Causes of abnormal vaginal discharge: yeast infection, bacterial vaginosis, vaginal atrophy. Pregnancy, sexually transmitted infections, e.g. chlamydia trachomatis, gonorrhea, trichomoniasis. Pelvic inflammatory disease, cervicitis, vaginitis, cervical cancer, vaginal fistula. The answer is D. Abortion.